As we get older, protecting our hearts becomes more important than ever. But what if the biggest danger isn't your diet, your stress, or even your genetics? What if it's sitting quietly in your medicine cabinet? Today, leading cardiologists are sounding the alarm, not about rare diseases or surgical procedures, but about common pills many older adults take every day, often without realizing the risk. We're talking about medications that are FDA approved, doctor prescribed, and widely used. But in aging bodies, they can quietly increase your risk of heart failure, stroke, or sudden cardiac events. And the worst part, most seniors never get warned. Prescriptions get renewed automatically. Side effects are mistaken for just aging. And dangerous combinations are too often overlooked. But that changes today. In this video, we're counting down 5 pills that can damage the hearts of older adults, especially after the age of 60. Some of these you may recognize. Others might surprise you, but all of them deserve a second look. This isn't about fear. It's about facts backed by research, trusted by experts, and explained in plain English. If you're over 60 or care about someone who is, watch closely. Because what you're about to learn could protect your heart, your independence, and maybe even your life. Let's begin with number 5. It's in almost every home, and it may be quietly increasing your risk of heart failure, fatigue, and long-term cardiovascular damage. Number 5, ibuprofen and NSAIDs, the hidden strain on aging hearts. Ibuprofen, naproxen, diclofenac. These painkillers are in nearly every home. They're trusted, familiar, and easy to find. When pain flares up from arthritis, a stiff back, or a lingering headache, most people take one without a second thought. But after 60, these common pills can quietly become a serious risk to your heart. NSAIDs, or non-steroidal anti-inflammatory drugs, do more than relieve pain. They also affect how your kidneys manage salt and water. In younger adults, the body usually adjusts. But with age, kidney function naturally declines, even when lab results look normal. That decline means your body may begin retaining extra fluid. You might notice swollen ankles, tighter shoes, or a heavy feeling in your legs. You may feel more tired by the end of the day. These symptoms are often mistaken for aging, but in many cases, they're warning signs. Fluid retention increases the workload on your heart. For older adults, especially those with high blood pressure or a history of heart disease, that added pressure can lead to worsening heart failure or dangerous changes in blood pressure. And the risk doesn't stop there. NSAIDs can also reduce blood flow to the kidneys, further weakening their function over time. They've been linked to elevated blood pressure, kidney damage, and even increased risk of heart attack and stroke. And the longer you take them, the more those risks add up. Even short-term use can be risky, especially when combined with other medications like diuretics or ACE inhibitors, creating a dangerous trio that can severely impair kidney function and increase heart strain. What makes this so dangerous is how subtle it all feels. You won't feel your kidneys struggling. You won't feel your heart working harder. The symptoms are quiet swelling, fatigue, dizziness, easy to dismiss as just getting older. And because NSAIDs are over the counter, they don't seem serious, but that's exactly what makes them so risky. If you're taking NSAIDs regularly and you're over 60, it's time to ask your doctor whether they're still the right choice. You may not need to stop them completely, but using them occasionally, not daily, can make a big difference. Depending on your needs, safer options may include acetaminophen for certain types of pain, or topical treatments that don't affect the heart or kidneys. Lifestyle approaches like stretching, heat therapy, or physical therapy can also help manage chronic discomfort. The goal isn't to suffer in silence, it's to treat pain without creating bigger problems. Because for older adults, NSAIDs can seem harmless, but may quietly be putting your heart at risk. Now, let's move to number 4. It's not a painkiller. It's not for your joints or your back. It's something often prescribed to help you sleep or calm anxious thoughts. But for older adults, it may be slowly stealing your clarity, your balance, and your independence. Number 4, benzodiazepines, the sleep aid that can steal your stability. If you've ever struggled with falling asleep, staying asleep, or calming racing thoughts, your doctor may have prescribed something like lorazepam, temazepam, or diazepam. These medications belong to a class called benzodiazepines, and for many older adults, they feel like a lifeline, a pill that helps you sleep through the night. A pill that takes the edge off anxiety. A pill that just helps you feel normal again. But what if that same pill was also quietly increasing your risk of falls, confusion, or even long-term cognitive decline? Benzodiazepines work by slowing down activity in the brain and nervous system. That's why they help you feel calm, sleepy, or less anxious. But in older adults, that same effect can go too far. These medications don't just relax your brain, they also slow reaction time, muscle control, and balance. That combination increases the risk of falls, especially during the night when grogginess is at its peak. And falls aren't just minor accidents at this age. They're one of the leading causes of injury, hospitalization, and loss of independence in seniors. But the danger goes deeper. Benzodiazepines are also linked to memory issues, mental fog, and even a higher risk of dementia when used long-term. What often starts as mild forgetfulness or difficulty concentrating can gradually progress, and most people never trace it back to the medication. And then there's the issue of dependence. Your body adjusts to benzodiazepines. Over time, you may need more to get the same effect. And stopping suddenly can trigger withdrawal, with symptoms like anxiety, insomnia, restlessness, or even tremors. It becomes a cycle. You need the pill to sleep, but the pill may be slowly damaging the clarity and stability that sleep is meant to support. So what should you do? First, don't panic and don't stop the medication suddenly. That can be dangerous. If you're taking a benzodiazepine, talk to your doctor. They may suggest a slow, supervised taper or explore safer alternatives that don't carry the same risks. There are non-drug therapies that work. Cognitive behavioral therapy for insomnia is one of the most effective treatments for chronic sleep issues, and it doesn't come with side effects. For anxiety, approaches like mindfulness, breathing exercises, light exercise, or even certain antidepressants can be helpful without the same risk of balance or memory problems. The key is knowing that not all sleep or anxiety needs a sedative. And for older adults, what seems like a small dose of relief can come with a high cost. Because that little white pill that helps you drift off might also be quietly pulling away your balance, your awareness, and your independence. And if you found this video helpful so far, take a second to like, subscribe, and tap the bell so you don't miss the next video. Now, let's move on to number 3, a pill taken by millions of seniors for heartburn and reflux, but one that may be weakening your bones, draining your nutrients, and raising new risks you've never been warned about. Number 3, proton pump inhibitors, the silent drain on your heart and body. Heartburn, acid reflux, indigestion, they're more common as we age. And for many people, the solution comes in the form of a little pill. Omeprazole, pantoprazole, esomeprazole, known as proton pump inhibitors, or PPIs. These medications work by reducing stomach acid, and for short-term relief, they can feel like a miracle. No more burning chest, no more sour taste, no more pain after meals. Just one pill a day, and the discomfort disappears. But here's the part most people never hear. These pills were never meant to be used long-term, especially not in older adults. Millions of seniors take PPIs every day for months, sometimes years, without ever reevaluating whether they still need them. And over time, that quiet routine can come with serious consequences, some of which directly affect your heart, your bones, and your overall strength. One of the most overlooked effects of PPIs is how they interfere with nutrient absorption. Stomach acid isn't just there to cause discomfort. It helps your body absorb key minerals like calcium, magnesium, and iron. When acid levels drop too low for too long, those nutrients don't get absorbed the way they should. Low calcium means weaker bones. In older adults, that translates into a higher risk of fractures, especially hip fractures, which can be life-altering. And it doesn't stop at bones. Magnesium deficiency, which is more common in long-term PPI users, can affect your heart rhythm, cause muscle cramps, or even lead to dizziness and fatigue. Low iron and vitamin B12 can cause anemia, nerve problems, or mental fog. All issues that can look like natural aging, but may actually be medication related. And then there's the immune system. Stomach acid plays a role in protecting you from harmful bacteria. When it's too low for too long, your body becomes more vulnerable, especially to infections like C. difficile. a gut infection that can cause severe diarrhea and dehydration, particularly in older adults. Some studies have even linked long-term PPI use to higher risks of kidney disease, dementia, and cardiovascular problems, although more research is still ongoing in those areas. But the pattern is clear. The longer you take these medications without reviewing your need for them, the more the risks begin to outweigh the benefits. That doesn't mean PPIs are bad. They're effective, and in many cases, they're necessary, especially during an active ulcer, esophagitis, or certain stomach conditions. But what should be a temporary treatment often turns into a permanent habit. If you've been taking a PPI for more than a few months, it's worth talking to your doctor. You may still need it or you may not. Some people can switch to lower doses, take the medication only when symptoms flare up, or taper off entirely under medical supervision. Because sometimes relief today shouldn't come at the cost of your strength, balance, and resilience tomorrow. Now, let's move on to number 2. A medication that's supposed to protect your heart, but in the wrong dose or combination may actually be putting it in danger. Number 2, heart and blood pressure medications, when the cure becomes the risk. When we think about medications that damage the heart, blood pressure pills usually don't come to mind. In fact, they're supposed to protect it, to lower the pressure, reduce the strain, and help the heart do its job more efficiently. And for millions of older adults, these medications are essential. But here's the uncomfortable truth. The same medications prescribed to protect your heart can also put it at risk, especially if the dose is too strong, the combination is too complex, or the body has changed since the prescription was written. Let's start with diuretics, often called water pills. These medications help the body release excess fluid and salt. They're commonly used to treat high blood pressure or heart failure. But in older adults, they can lead to dehydration, low potassium, sodium imbalance, and dizziness. That tired, lightheaded feeling when you stand up, it may not be aging. It might be your water pill pulling too much from your system. Then there are calcium channel blockers, which relax the blood vessels to reduce pressure. But in some seniors, they cause swelling in the legs and ankles, slow the heart rate too much, or lead to fatigue and brain fog. Beta blockers, another common class of heart medication, can be just as tricky. They slow the heart rate, which is helpful, but sometimes too much. This can cause shortness of breath, cold extremities, and reduced exercise tolerance. In people with diabetes, beta blockers can even mask signs of low blood sugar, creating a hidden danger. The truth is, the body changes dramatically with age. Blood vessels stiffen, kidneys filter more slowly. The way your body handles salt, water, and pressure shifts, meaning a dose that worked well at 55 may now be too much at 75. And it's not just about one pill. Many older adults are prescribed multiple heart medications. A beta blocker, a diuretic, something for rhythm, something for cholesterol, and the combination can quietly overwhelm the system. This is called polypharmacy, and it's incredibly common in seniors. One medication leads to another to balance the side effects, and before long, the body is juggling 6 or 7 prescriptions at once. You start to feel off, foggy, weak, less steady on your feet. You might assume it's age. But in many cases, it's medication overload. And when heart medications start interfering with balance, kidney function, or energy levels, the risk of hospitalization goes up not because of the heart condition, but because of how it's being treated. Now, to be clear, these medications can be life-saving, but they need to be reevaluated regularly, not just renewed out of habit. The goal isn't just to control numbers on a chart. The real goal is to help you stay sharp, steady, mobile, and independent. If you or someone you love is over 60 and taking multiple medications for blood pressure or heart disease, ask, are the doses still right? Are they working together or against each other? Because the right heart medication can save your life, but the wrong combination can quietly steal it, piece by piece. Now, it's time for number 1, the most dangerous pill of all. Not because of what it is, but because of how many you're taking. Number 1, polypharmacy. The most dangerous pill is all of them. If there's one pill that poses the greatest risk to older adults, it's not a single pill at all. It's the combination. Polypharmacy, the term for taking 5 or more medications at once, has become one of the most dangerous and overlooked threats to senior health. And it's shockingly common. In fact, studies show that nearly half of all adults over 65 take 5 or more medications every day. Many take far more: a pill for blood pressure, another for cholesterol, something for sleep, something for pain, an acid reducer, a vitamin, a mood stabilizer. One pill leads to another and another, until your body is juggling a complex mix of drugs that were never tested together, especially not in aging systems. And here's what most people never hear. Every new medication increases the chance of side effects. Every combination raises the risk of harmful interactions. Every extra pill makes it harder for your kidneys, your liver, and your heart to keep up. The effects aren't always dramatic. They're subtle. You feel more tired. You're less steady. You start forgetting things. Your digestion slows down. Your mood shifts. Most people assume it's just part of aging. But sometimes it's not. It's the pills. And the most troubling part, many of those prescriptions are no longer needed. They were given months or even years ago and never reevaluated. Sometimes the original condition has changed. Sometimes the side effect of one drug is being treated with another. It creates a quiet spiral, not into better health, but into fatigue, frailty, and dependence. Polypharmacy doesn't just put strain on your heart, it can steal your clarity, your energy, your independence. The solution isn't to stop everything, it's to review everything. A skilled doctor or pharmacist can help you go through your list, identify outdated medications, reduce what's unnecessary, and adjust what's still needed. And the results can be life-changing. Less dizziness, more energy, better focus, a clearer mind, fewer falls, fewer hospital visits, and sometimes just feeling like yourself again, maybe for the first time in years. Because health isn't always about adding more. Sometimes it's about letting go of what's no longer serving you. If you or someone you love is on 5 or more medications, don't wait. Schedule a medication review. Ask the hard questions. And don't be afraid to advocate for yourself. Because the most dangerous pill might be the one you didn't realize you were still taking. If you found this video helpful, give it a like and subscribe so you don't miss the next one. We break down health topics like this every single week. And in the comments below, tell us, how many medications are you or a loved one currently taking? Have you ever questioned whether they're still necessary? Your story might help someone else more than you know. And remember, sharing this with a friend or family member could be the first step in protecting their heart.